consultant hematologist and HIV physician at the Lagos State University College of Medicine, LUTH, where she is the present head, Department of Hematology and Blood Transfusion. She holds a fellowship in hematology from the National Postgraduate Medical College of Nigeria, NPMCN, and is an avid researcher. To this end, she has published over 70 research articles in both national and international peer-reviewed journals. Professor Uche is a Harold Gunsen Fellow, as well as a Fellow of the EU-sponsored African Research Innovative Initiative for Sickle Cell Education, ARISE. She is a member of various professional bodies and has attended numerous national and international scientific conferences where she has presented some of her research work. She is involved in teaching undergraduate and postgraduate hematology and blood transfusion, HIV medicine. Her hobbies include dancing and reading. Ladies and gentlemen, let's make a resounding welcome to the HealthyU Summit 2024, Professor Ebele Uche.
Thank you very much. Good morning, everybody. Sorry, it's actually afternoon. Good afternoon. Thank you for that kind introduction. I just want to say thank you, first of all, to Pastors David and Lydia for inviting me. It's an honor I do not take for granted, and thank you. Before I start, just a quick question. How many of us have done our annual health checks? The year is almost over, so anybody that is planning, anybody that has the habit of doing an annual health check should have done it by now. So how many of us have done that? Very few. So you see, in Nigeria, when it comes to our health, we tend to be reactive, right? Reactive in the sense that until something happens or until you develop a symptom, before you now think that it is important to seek medical care. But I want you to understand that before a symptom of any disease develops, a lot of damage has gone on. And so that is why we tend to say that preventive medicine is easier and far cheaper than curative medicine. You heard the story of a very, very amiable MC. Just a random medical check probably saved the life of either he or his wife. So please, if there is nothing else we take away from this gathering, let it not just be that a lot of us have attended many of these things. Like my colleague said, there's really nothing new that we want to say that has not been said. But the issue is not in the knowing, the issue is in the doing. And so if we do not take anything away from this conference, and sorry, congratulations on your 9th year. Congratulations on your 9th year. If we do not take anything away from this, gathering, please take away the fact that it is important that we do a yearly check. Now, whatever the test you're going to do, there are a lot of tests, right? So you can't possibly be doing all the tests, but there are basic tests that you should do. And so I want to encourage us, and especially as Nigerians living in Tinubu's economy and then living in Lagos. I always say to people that living in Lagos is an extreme sport, because you wake up at 5 a.m. I can agree with him that a lot of us barely get 6 hours of sleep. I barely get 3 to 4 hours on a good night, and then I'm out again. And so the wear and tear that is going on in your body, when you add the wear and tear that goes on normally, physiological aging, because as you age, there's wear and tear, right? But then you are now in an environment where you now have external stressors. So you have your internal stressors. You are now in an environment where you have additional external stressors that are even more overwhelming than the internal stressors. By the time NEPA takes lights, by the time you get home, your transformer has blown. By the time there's so much. So if you do not intentionally, there has to be an intentionality about taking care of yourself. A lot of us take care of the externals. You want to make sure you are working to pay your school fees, to pay your rent, to do everything, but you are not taking care of the body that is making all those things possible. I always say to my patients, when the patients will say, "Oh, doctor, I don't have time to rest," they will not give me leave. I always say to them that if anything happens to you today, the next meeting, 1 minute silence. That's the end. Death is so rude. Time does not stand still for anybody. The world doesn't end. So please, this is just a preamble. Let us take our health very, very seriously. Today I'm supposed to be talking on understanding chronic diseases, pathology, insights for better health choices. So the first thing we want to ask ourselves is that, what is a chronic disease? So when you have a chronic disease, that means you have an acute disease, right? So, but today we are focusing on chronic diseases. A chronic disease is just any long and is progressive. And most literature would give you a time frame of 3 months. So any disorder or disease, so the WHO likes using disorder now for most things because disease has a certain connotation. So things like sickle cell disease are now called sickle cell disorders, right? So any chronic disorder, any disorder that has lasted for more than 3 months is categorized as a chronic disease. And this is against the acute disease disorders, where the symptoms or the signs usually last for less than 3 months. And it is important to note that most chronic diseases cannot be treated, they can be managed. Treated in the sense that, for example, I have malaria. I feel feverish, I feel tired, I feel cold. I go to Pastor Lydia's lab and they do a malaria parasite. It's positive. The doctor prescribes anti-malarials for me. I take my medications and I am fine. That means I have treated my malaria. Well, most of these chronic diseases cannot be treated. They can only be managed. Managed in the sense that as long as you are taking your medication, most of the symptoms would disappear. And then most importantly, the progression would stop. And for some people, for some disorders, you can even reverse the progression to a large extent. But the minute you stop your medication, you're back to square one. So for example, people that are hypertensive, a lot of people are hypertensive, but they just feel that, oh, I went to the hospital, my blood pressure was high, they gave me medications, my blood pressure became normal and I stopped. Once you're hypertensive, you're hypertensive. Okay, so there's increased blood pressure that might be due to stressors. Maybe you're having a lot of work stress, or maybe there's a bereavement in the family or something that temporarily causes your blood pressure to rise. So that is different. But once the doctor has told you are hypertensive or you are diabetic, then that means that you are in for a lifelong treatment. And the minute you stop the treatment, you are back to square one. And so we say that most chronic diseases cannot be treated, but they can be controlled. In the past, the chronic diseases used to be known as the non-communicable diseases, in the sense that they are not diseases that you can contact from each other, like hypertension but there are a few exceptions, which are usually the viral infections. Like HIV, it's communicable, but it's also a chronic disease. Things like the chronic hepatitis, whether it's hepatitis B or C, those are communicable, but they are also chronic diseases. But for the most part, most of the chronic diseases are usually non-communicable. And we would see that the chronic diseases are they are a leading cause of morbidity and mortality. Morbidity simply means sickness. Mortality means death. And so they are a leading cause of sickness and death all over the world. And some statistics, according to the WHO, has put it that about 63% of all adult deaths every year occur due to chronic diseases. So you can see the burden that chronic diseases puts on the system. And these chronic diseases have an impact on the quality of life of the individual. So for example, if someone that is battling hypertension, diabetes and all, you see that it's not just that individual that is suffering, the family members. And then by the time the disease progresses, it now becomes the community. I'm sure a lot of us here have donated once or twice to people that, oh, this person needs a kidney transplant, this person needs this. So the impact of chronic diseases on the society, financially, emotionally, and every other alley, is quite huge. And examples of chronic diseases, my colleague mentioned a chronic disease can occur in any system. Things like asthma, things like cancer, HIV, hepatitis B, Alzheimer's disease, chronic kidney disease, hypertension, diabetes, arthritis. These are all chronic disease that once those diagnosis is made in an individual, that individual, medically speaking, I like using medically because I'm a Christian and I believe in miracles, right? So, but medically speaking, it's lifelong, right? So you can't just decide on your own, oh, my diabetes has gone medically. Your diabetes cannot go, because once you go back to your former lifestyle, I can assure you that the diabetes would come back. And it is very important that because these disorders are progressive, right? An individual can start off with one chronic disease and then end up with 3 or 4. So, for example, an individual has diabetes and refuses to stop drinking Coke, stop drinking malt, just refuses to adhere to every instruction that has been given. So what that individual is doing is that the individual is putting petrol on that diabetes, and so that diabetes is progressing. So the next thing you would hear is, oh, I cannot see well. What has happened? The diabetes has affected the eyes, and so the person now starts battling with cataract. And then the next thing, the person starts swelling up. What has happened? The kidneys have gone, so that person has added a chronic kidney disease. And so a lot of times when a chronic disease is present in an individual, if not properly managed, it can progress, right? And apart from progressing, it can also lead to the development of other chronic diseases. Most of these chronic diseases, except for the ones that are caused by the viruses, the causes are not known, okay? But they are what we call in medicine risk factors. And so we say these are the risk factors that are associated with hypertension. And most of these risk factors are genetic. They have to do with genetics, they have to do with dietary, they have to do with lifestyle. And a lot of times there are multiple risk factors in an individual. Okay, so for example, again, I use the example of hypertension. The fact that you are black has already put you at risk for hypertension. Okay, that you are black is just like the fact that you are a black female has already put you at risk for a fibroid. So that is one risk factor. So we'll go back to hypertension. You are black, you have one risk factor. You have a positive family history of hypertension, that is a second risk factor, right? So then you now add to the fact that you are a junkie for fast food. So you don't eat proper food. You are always eating all the fast food, all the fried, high saturated fat. So pizza, but you are black, you cannot modify that, right? You have a family history of hypertension, you can't modify that. But there are things you can modify. So things like your diet, you can modify. Things like your lifestyle, alcohol, drinking, smoking, sedentary factors, that if you are able to work on those risk factors, then you reduce the likelihood of you coming down with any of those diseases. And then even if you do come down with those diseases, remember there's also a genetic component. And so you can see Mr. A has the same risk factors as Mr. B, but Mr. A will develop hypertension, Mr. B will not develop. So genetics also comes into play. But I always say to people, do your own parts, right? Make sure that you've ticked all your boxes. Make sure that everything you are supposed to do, sleep, when they say sleep, we just think that it's just sleep. If you know how getting quality sleep reverses a lot of inflammatory processes in the body. And I'm not just talking about, I sleep well 2 times in a week. No, I'm talking about consistently, intentionally getting quality sleep. I get a lot of patients that say to me, oh, Prof, I don't sleep. So what do you do? Because I don't sleep, I just play with my phone. So how would you sleep, right? So when you say you do not sleep, you need to be intentional. So I always say to them, even if you feel that, you are not falling asleep, even if your body is not sleeping, let your mind be resting. Do you understand? But by the time you're on the phone, oh, you're on Instagram, you're on Insta blog, then you now see one comment, then you now click on that person will take you to another so before you know it, you have spent, how many of us are, before you know it, you have spent 4 5 hours doing nothing, because it's nothing. It's just a, I'm not saying, I mean, those things are good for recreation, right? But when they now said, oh, asked him a few questions, and he didn't he answered, of course there were no issues and all that, and by the time we did all his screening tests, it turns out he's HIV positive. So we get a lot of them in the hospitals, people that just, in fact, if you come to a typical clinic, you would actually leave depressed. I'm telling you, I'm sharing, because it's almost as if there's a floodgate that has opened to cancer. I kid you not. It's I'm happy, that we are having this kind of conference, and I do wish that, this type of gatherings are done on, like he said, next year we'll do a co-hotel, because it's important. So for example, there's an adult goes to a private hospital, an adult that is well, that is not bleeding well, in the sense that he's not bleeding or anything, he's just complaining of, oh, I'm tired. You go to the private hospital, they do your PCV, somebody sees that your PCV is 18%, and is just transfusing you without bothering to ask, why would an adult, because I keep asking, why would an adult that is not bleeding, why should you have a PCV of 18? That means there's something wrong. And I can tell you that, I'm not exaggerating, 70% of the leukemias that end up in our clinic in Lasut have been to so many places. There was one man that came 2 weeks ago. He had been transfused with 32 pints of blood. So he had gone from one hospital to the other, and nobody, I mean, these are stories that you hear, and you see that in Nigeria healthcare, we honestly have a lot to do. We've not even scratched the surface. An adult has been transfused 32 times, and nobody thought to say that, no, it was just the last hospital he went to that they said, no, we can't transfuse you again, let's send you to the hematologist. Being that, as adults, and then even as mothers and fathers of children, take responsibility for yourself. Why would a doctor say to a man, and it's not like the man is, he may not be, he's not an illiterate, but it's just because he doesn't know. Why would a doctor be telling a man that your PCV is 18, I'm going to transfuse, and then you're not asking him, but why? That should be the next question. And so that's why I always say to my patients, it annoys me when a patient comes and says, oh, I've been treated for this, and I said, with what? And I ask, with what? And they say, I don't know. How do you allow people give you medications and give you treatment? They will tell you they give you IV, they give you injection, and you don't know the name. Please, I could go on and on, but I think my time, we can take any other thing during the questions and answers. But I just want to encourage us that preventive medicine is much cheaper than cure. Is low, see your hematologist. Your blood sugar is high, see your there's always recommendation. And so it's not just enough for the first step, of course, is good, do the test, but the second step would be act on the test, because like they said, wisdom is what? The application of knowledge. Thank you.